This is Chloe. She was 6 months when she was diagnosed with infantile spasms. Now she's 9 months and she is doing amazing. She's making milestones and just a really sweet, wonderful, loving, pure joy.
Infantile spasms are a different special type of seizure. They can be sudden jerks, startles, stares, sometimes associated with a cry, but very sudden and repetitive. They'll happen over and over and over again. And they're a type of seizure that the whole brain is involved all at once.
She would often bang her head against my chest, causing her to cry. It was super subtle. It would happen in a series over a few minutes. Could have easily been missed as a sudden, just normal baby movement, but there was something involuntary about it, and that didn't seem right. And the fact that it happened in a series over a period of time, a few minutes, made us concerned.
It's important to pick up infantile spasms early on. Typically a family will come in and they'll say to you, my baby's not acting right, they're doing some unusual movements, and their unusual movements are repetitive. They happen again and again. And so that's typically a sign to say, what is going on here?
I started to do some research. I looked online, found very little information. I came across a blog and one mother mentioned infantile spasms. So I looked up videos of infantile spasms. It didn't look like how she was doing it when I was holding her. It wasn't until I saw her spasming from a laying down position that it looked like the other videos of her head going forward, the arms moving out. And I took a video clip of her having a spasm. From there, I sent that to the pediatrician, said I think my child might be having infantile spasms.
If you suspect that your child has spasms, if there is any inclination that these things that they're doing do not look like colic, or you just think it's odd, you need to go immediately to an emergency room, preferably one with an epilepsy center, and get admitted for a video EEG. You should not be calling the neurologist to make an appointment in 3 months. You should not be being told that it's just colic and it'll go away. You have to be very forceful and aggressive and get the child admitted and do the video EEG overnight.
The whole process was very, very difficult, emotionally, somewhat of a roller coaster. I actually stayed pretty strong through the diagnosis process. You know, at first there was a little bit of denial, but that quickly passed when I realized what was going on, and I read about that time is of the essence. The quicker you take care of it, the better.
The risks of infantile spasms that are left untreated are, of course, there's the usual risk of sudden death from epilepsy, and then the infantile spasms can develop into a much worse epilepsy. So the risk is that you're going to have uncontrollable epilepsy evolving into a Lennox-Gastaut pattern, or that you're going to have continued other sorts of seizures.
The risks, if you don't treat infantile spasms, are basically bad. It really affects learning, processing, development. Children who have uncontrolled infantile spasms have a high risk of mental retardation, cerebral palsy, so problems thinking, problems walking, problems doing things. So, you know, we need to treat it. We need to stop the seizures. If you don't stop the seizures, the brains aren't going to develop well.
Time is of the essence with infantile spasms, and the sooner you catch it, the better. You know, we don't know what the future holds for Chloe. She could have some kind of learning disability, developmental delay, but we're optimistic that she will be okay because we did catch it early and are treating her.
If you're a parent and you see something that looks suspicious, whip out your phone, get a video camera, get a witness, all right, and record it. All right, and then go visit your pediatrician and discuss it. Don't panic yet, because there are many times that patients come to us and they show us videos and they're not seizures, thank goodness, okay? But sometimes they are, and we're happy about that because then we can get them the treatment right away.
In honor of Infantile Spasm Awareness Week,
Please share this video
With family and friends.
and help us bring awareness to the world.